Hi, this is Dr. David Klein, Stages of Life Medical Institute, Longwood, Florida. And I promise this will be short, okay? And this is going to be ventilators. What did we learn from this crisis? Most people that were watching the news hadn't a clue as to what a ventilator was all about. Okay? These are machines that you use to breathe for folks. It's a pump. It's an air pump. Pressure sensitive, pressure driven, volume driven, but a pump nevertheless. An expensive pump, a fancy pump. Lots of gadgets. Very, very interesting. And they're just a tremendous treat in the middle of the night to get the right settings. I had to do this for a long time. Ventilators. So you heard a lot of screaming and crying. We don't have enough ventilators. We need 40,000 ventilators. We want. And the public, by and large, led by the press, almost exclusively, bought off on this as if it were really important. Now let me give you a little clue as to what's going on with ventilators. It's easy to make a ventilator, and they're not that expensive, 30, 40 grand, 20 grand. You know, you can buy them used online. eBay has them. They're not that expensive. Every hospital has an attic full of old ones. It's not a big issue. The real problem isn't the ventilators, because it might only take a day to make a ventilator. It may only take a few hours to assemble one. What takes time are the intensive care unit nurses that take 25 years to make, from conception to handing them the diploma and then training them to operate these things. So you can roll out as many ventilators as you want. It's a whole lot harder to get people to operate them. Therein lies the weakness that we had in this system. So they could have had as many ventilators as they want, but they did not have, and they do not have, the personnel to operate them. How many intensive care nurses does it take to operate 1 or 2 ventilators? And the answer is 1 for each one, optimally. One may be able to handle 2 if they're given roller skates. Okay, but think about the total number of ventilators that were asked for and the total number of intensive care unit nurses, and you're going to find that there's a difference of 0. That's a decimal place difference. 1/10 as many people are available to run these things as were currently available. So preparedness is something that you learn in the military, and I did 12 years of that. You know, all this stuff all over your shirt. It was kind of cool. It was fun. But you learned about preparedness. You also learned that if you're going to go out and fight a war, you fight with what you have in your duty bag, okay, your C bag, your go bag, whatever it happens to be. You have your own equipment, okay? If you're allowed, you have your own weaponry. Why? Because you don't necessarily want to trust low bid equipment. Okay, that's just the way that it works. You bought your own stuff. You paid for it because your life might depend on it. So what is the lesson learned with ventilators? Is that the equipment isn't as important as the staff and personnel. We have to protect these individuals. We need to treasure them. We need to retain them. And we need to train more. These are not people that you can get at the temp agency. This is Dr. David Klein, Stages of Life Medical Institute, worried about the intensive care unit. Have a nice day.